Sure. My name is Eva Nowara, and I am currently a research scientist at Meta. Well, I am Polish, but many years ago, maybe 700 years ago, my family supposedly originated from Italy. So the last name is Italian, but it is with a Polish spelling. Sure. So I just started at Meta about 3 months ago. So I don't have a lot to share yet. I'm still learning as I go, but I am working in a applied research team. So we do research and come up with new ideas for enhancing the AR and VR experience. But we also are interested in putting our ideas in products. So it's an interesting, exciting, unique position sort of in between where you get to do innovative, creative research and publish papers, but at the same time, you can see your work realized in products. So my position builds a lot on my past research in computer vision about scene understanding, and just extracting information from images and from video. So prior to coming to Meta, I was a postdoc at Johns Hopkins University, where I worked with Professor Rama Chalapa on geolocalization, which means that given a single RGB image taken anywhere, maybe from your window in your house, we want to determine where that image was taken, and be as specific as what country, or what city, or even what street the image was taken at. And prior to that, I worked in a different area of computer vision for my PhD at Rice with Professor Ashok Viraragavan, where I worked on camera-based physiology. So given a video recording of someone's face, my interest was to extract very subtle color intensity variations in the skin related to their blood flow, from which we can measure heart rate, breathing rate, and other vital signs and clinical parameters. So it's essentially how a smartwatch works, like a Fitbit or an Apple Watch, where they have this green light that illuminates the skin, and some light penetrates the skin, some light returns to the sensor, and the light that has interacted with the blood will have this pulsatile temporal component. So it's very tiny change in the intensity of the skin, but from that we can measure the pulsatile signal, from which we can extract heart rate and other parameters. And so I was working on doing it from a video recording without touching the skin, which is very challenging. Lots of noise, motion, illumination variations. And so that I have spent several years doing that, and that has been my main focus of my research. That's right. Yeah. Oh, it's definitely important. I mean, yeah, I've always been very inclined to work on things which are exciting but challenging, things which we don't know if they are possible or not, because it's a very difficult problem. It hasn't been done before, but we have some basis to believe that it might be possible. That has been very exciting. Of course, frustrating and stressful at times as well when you have to graduate as a student, or even as a professional. You need to make a living and you need to get some results. But it's very exciting that you can do something for the first time, and that whatever you're working on is actually useful, is put in some product, or has some use, hopefully for some positive applications to improve people's quality of life or enjoyment of life. So that has always been very important to me and has guided how I choose my projects and the postdoc, and also this full-time job. And that has been the underlying theme, looking for work that is challenging, innovative, where I can grow and also have impact on products. Yes, that was my dream job. I have always wanted to be a research scientist, or for a very long time, I wanted to be where I am now. I guess I wasn't sure if I would make it, because these positions can be very competitive, but also there aren't as many of them, because there's only so much need for research in a company, and you need to have strong publications and so on. So I'm very happy that it worked out. I was reaching out to several mentors, people who I have interned with, and my PhD advisor, several other professors, and also peers who have gone through a similar process. And it has been very reassuring. They told me, that sometimes it's more about the timing. It's a bad time right now to apply for these positions. Many recommended doing a postdoc and trying to work on something new, get some more publications. Yeah, let me think about it. I think so. My PhD advisor gave me many pieces of advice along the way, but I think one that stuck with me, he said I should first go for my top positions, so interview at the top place, because if I interview at my second and third choice places, I will likely get an offer, and then what do? You don't have any other offer, right? So you will probably take it. Actually, this happened to me because I did get some offers which were pretty good, but it definitely wasn't a dream job. Yeah, so that advice really stuck with me. So I had a pretty good offer from a company. It was a research engineering position. I wasn't super excited about the company or the position, but it was pretty good and good, pretty good compensation. I didn't have really anything else. And
so you did not follow. So you did not follow this advice.
Well, I tried to interview, where I could, because I didn't want to turn down the interview, and it seemed like a good option. Maybe not top, but I wasn't sure what I could get. So I guess I sort of didn't exactly follow, but I wasn't able to land the interviews at my top places at that time in 2020 because Meta and other places paused hiring for research scientists. But then Professor Chalapa reached out to my advisor, Ashok, asking if he has any students who are interested in a postdoc. And Ashok recommended that I talk to him. And so I did get the postdoc offer. And so I had this very challenging decision to make. I have a full-time job offer. I'm on a visa, so I do need some sponsorship eventually. So that was a stressful thing to decide between. And then potentially this opportunity to take this postdoc that maybe will open doors for my dream job, but maybe not, who knows? And maybe I won't get another offer like that, full-time offer. So yeah, so that took a lot of deciding, and I did sacrifice I guess some things to be here, because I left my family back in Poland. I'm here by myself without family. So I was thinking back, I spent all these years going to college here and grad school and really trying to do something worthwhile. And so I shouldn't settle right now. I don't have a reason to settle. So I should, just take a chance and see what happens. And so I decided to take the postdoc. And I, for a long time, wasn't sure if that was the right decision, because then I have to start all the interviews again. And kind of start the stress of interviewing and this uncertainty, but that also opened some possibilities.
Can you tell me one thing about yourself which is important and that we did not discover yet?
Okay. Yeah, so maybe I'll just briefly talk about where I came from, or how I ended up where I am. So yeah, so nobody in my family is doing this sort of research in industry or anything related to computer vision. My mother was a very strong figure in my life. She is a physician. She's an oncologist, and which is a very challenging specialization in medicine, unfortunately, because of low success rate of treatment. And so she pursued a PhD degree as well. So she is an MD PhD and was a professor for a short amount of time, but mainly focused on her clinical practice. And she has always been this very strong figure who has been an inspiration of, how as a mother, and a female in a male-dominated workplace, same in medicine as in engineering, and same in Poland as it is here, that you can succeed and you can be a good mom and a good wife and, I don't know, have a normal life. I never felt like, my mom worked a lot, but I never felt neglected. I felt like we always spent a lot of time together, went on vacation, played games, helped me with my homework, but definitely was very, like aggressive with her career choices, worked very hard, and also took a lot of chances, has been super successful, going to all the conferences, publishing papers while working with patients, and always just kind of having this attitude that, like you shouldn't complain, just work hard, and, like it's not hard, you'll be fine. Yeah, so that has always been very motivating and kind of made me feel like, if she succeeded, I can succeed in a new field as well. And she has been very supportive.
That's very Eastern European to work hard and not complain of the difficulties.
Oh, yes, yes.
We in West of Europe, we complain. We complain a lot. Everything that does not work in Italy, I can tell you.
Yeah, we're definitely not allowed to complain. I think if we do, my mom is always like, well, if you don't like it, then then just quit and give up. But she says it in a sarcastic way. She's like, of course it's hard. Otherwise everyone would be doing it. So
Wow.
You'll be fine, stop complaining and get to work.
That's very nice.
Sure. I think that you can accomplish anything you want to accomplish. It might take a long time, and maybe you change your goals or priorities along the way, and that's okay. You learn during the process. And I think it's important to not give up and just keep trying. Sometimes it doesn't work out the first time or third time or 10th time, and maybe sometimes it's time to move on and try something different. But by learning from that process. But at the same time, I think you don't need to just work really, really hard and exhaust yourself. I think it's important to take care of your mental and physical health along the way, so that you can sustain this long journey and think of it as a marathon instead of a sprint, so that you do take breaks, you do take care of yourself, and kind of reassess your goals and what drives you, but keeping that long-term goal in mind and sort of not giving up, but keep trying.